The next step is to remove the temporary bung and screw the T-port in place. Now, when I remove this bung, the patient will bleed, and we don't want all that blood to get on the swab that's attached to the leg and cause contamination. So we're going to take another swab, we call this the catch swab, and we're just going to feed this up underneath our catheter bung. And then when we remove this temporary catheter, if we do get blood, it will go onto this swab, which we're going to discard later. Before I attach the T-port, I'm going to flush my catheter with some saline. So I'm just going to quickly remove my temporary bung, flush, and then reinsert my temporary bung. So I'm now going to attach our T-port onto the hub of the catheter. Now, before you attach it, just double check the tubing that there's no air bubbles in there, because we will be injecting saline and potentially other drugs and fluids through this later on, and we don't want to be injecting our patient. Also, when we're attaching, both ends have to remain sterile. Now, we already covered this end with the red cap, so we know that this area is protected, but I'm going to be removing the white cap to screw this end onto the catheter. So once this is removed, just make sure that you do protect the sterility of this end. So we're now going to attach the T-port. So pinch the hub of the catheter, remove the temporary bung, and pop the end of the T-port on. Now, you're going to screw it on tightly. Now, as when you're screwing it on, make sure you're pinching the hub of the catheter. If you don't pinch the catheter, what can happen is when you're screwing this on tightly, the catheter can just spin around in itself within the vein and can become dislodged, or you may think you've screwed it on tightly, but it's actually very loose. And then when you've wrapped up the leg, then the T-port can actually fall off.